When speaking of cancer survival rates, these basically depend on the type of cancer that has affected an individual. In addition to that, it is also based on the level of cancer growth and metastasis.
Experts also suggest that the survival rate of a person who is suffering from cancer is also affected by the treatment modality used. This implies that there is no specific or exact survival rate that you can use as a basis in the future. Usually, in every country, there are different details stated about cancer survival rates. That is why some information you might see in some countries might not be applicable to your own nation. Based from the published journals on health and wellness, patients who are suffering from lung cancer might have a 5-year survival period. This means that when the cancer cells are already detected in the advanced stage of the disease, a person might only approximately 5 years of life have here on Earth. As mentioned a while ago, cancer survival rates are not specific. Once you have consulted your doctor, he might not give you specific statistics. Like for instance, 53% of people who have been diagnosed with lung cancer in its early stage might be given cancer survival rates of about 5 years. On the other hand, some doctors might present more than 5 years survival rate. This is usually based on the information gathered during the diagnostic procedure. There are 2 survival rates that give more precise information about the matter, one of which is the disease-free survival rate. When speaking of disease-free survival rate, this is the number of individuals suffering from cancer who are capable of achieving remission. This implies that they are no longer manifesting any signs of cancer. Another one is the progression-free survival rate. This is the number of individuals who still suffer from cancer, yet their disease is no longer in progress. Particularly, these are cancer patients who have undergone successful treatment but the cancer cells are still not completely eliminated. Once you think that you already manifest cancer cell symptoms, it is important to seek proper consultation and diagnosis. Early detection of cancer cells will lead to higher cancer survival rates. On the other hand, people who will seek late medical attention where their cancer cells have already progressed should expect that cancer survival rates will be low enough. These are some of the things that you need to know when you are concerned about cancer survival rates. Obviously, there are no exact figures that can be recommended to you. This is because of the fact that the cancer survival rates are affected by different factors mentioned. What is more important is for you to prevent cancer cells from developing. You have to make sure that you will live in a healthy way since your lifestyle is contributing factors to the occurrence of cancer. Keep in mind that the saying prevention is better than cure is highly applicable in oncology.